Hello everyone. Good afternoon, good evening, good morning, wherever you're from. Thank you so much for joining us today. My name is Dr. Masika Sophie. I work for the World Federation for Animals. I also sit in the steering committee of the Multi-Stakeholder Partnership Platform on AMR, representing civil societies. To start us today, I want to really thank React for bringing all of us together today. And the discussion, in my perspective today, is we are asking one question. We are asking, what are the policies we are making? Are they for communities or are they with communities? Now, when we think of antimicrobial resistance, most of the time we think of policymakers, researchers, doctors sometimes, and even international organizations. But truly, are these the people who sit at the center of antimicrobial resistance? Are they the people at the front line of AMR? The reality really is that AMR is closer to home. It's with the mothers who choose the medicine that they need to use for their children, or the fathers, the farmers who need to try and keep their livelihoods afloat as well as protect or sustain the health of their livestock. It's with the communities at the ground supporting families to access healthcare in very difficult settings. Now, these are the voices that we want to talk about today, the voices that need to be represented in most of the discussions that we have at the policy level. Now, this brings me to the part of the role of civil society organizations. I represent civil society organizations in the AMR Multi-Stakeholder Partnership Platform, and I see us as bridge builders and conveners or partnership builders when it comes to antimicrobial resistance. We have a primary role to bring in the voices of those that are underrepresented, and in this case, it's communities. As connectors, we have to look at where practice and policy meets to ensure that the realities on the ground are actually translated in commitments that we make both at the global level, the regional level, and the national level. One Health is an approach that has been very much defined with the previous pandemic, the COVID-19. We see it more now in antimicrobial resistance. Anything that happens at the human health sector affects the animal health sector as much as the environment sector. So when we look at One Health from a community perspective, we have to look at it from a holistic angle. The farmer, the mother who chooses where medicine comes from or for their children, and the person working in the rice field looking at water permeating from livestock farms to their own water and sewage systems. Now, today, we want to focus on what is most important on antimicrobial resistance at the community level. How do we come up with policy decisions that are grounded at the community, policy decisions that can actually be that are implementable, feasible, and affordable at the community level? And I say today is not about sharing discussion findings from a survey. It is about centering what is most important when it comes to AMR policies, creating with communities and not for communities. After all, we say nothing for us without us, and in this context at the community level. So I hope the discussion today with the two panel discussions will answer these questions on how we can practically ensure that community voices are included in policy processes, and not just as a token of or a validation process, but truly as a way to ensure that the actions or the decisions that are made at the policy level are implementable at the community level. Thank you so much. Andrea, back to you.
Thank you so much, Masika. That was an excellent introduction, and also really paving the way now for discussing more about the survey, the results, and also the two panels, as you mentioned, that will be part of this webinar today. So allow me to share my slide. Yeah, there we go. And as mentioned, I will now present the results of the survey. The survey was launched a couple of months ago, indeed, to make sure to gather all the inputs from different communities and civil society organizations, in this case, towards the Abuja ministerial meeting. It's important to say that probably many of you already recognize, but the From People to Leaders, it's an initiative that started in 2024 ahead of the high-level meeting on AMR. Many of you that were present then are still supporting us today, and I want to thank you already in advance for providing your perspective and really believing in this platform that we are trying to provide with React and other colleagues as well. Now, jumping into the community priority survey, here I want to highlight a few of the numbers that came across, and then we will go through some of the results. So in total, we received 109 responses from 33 countries, and we could see representation across all WHO regions. Also, 82% of those who responded were from low middle income countries. And the perspective that we received were really cross-sectoral, so across the One Health spectrum. For those of you who were not familiar, I will present the different sections by which the survey was proposed. I also not going to go through all the results because it might take too long, but definitely we're going to share the full results after the webinar. So the first part of the survey was indeed about who were the respondent. So the type of organization, as you can see here on the left, that majority responded to the survey were both representing of civil society organization, but also of communities and academic and research institutions. As you can see instead in the graphic on the right side of your screen, the majority were coming from the human health perspective, but it was also quite an important percentage. You see 26% coming from the One Health as a cross-sectoral, as well as the other sector solely. Participants were also asked from which region they were coming from, primarily operate. And we could see here clearly two main regions responded and were part of the survey, which were the Africa region and the region of the Americas. But as mentioned before, all regions, as you can see here, were indeed represented in the responses. To give a bit more also granularity to those results, we also asked whether the organization was based in a specific country or was a global network or a regional network. So the majority were indeed country network, and you can see in the map on the right side of your screen which country were majorly represented in the responses. So we see obviously a lot of respondents from Nigeria, given the ministerial meeting indeed, but also from Ecuador and other regions in Latin America, but we had good representation, a number that we should mention also for India, Indonesia, and also other regions as well in Europe. The second part of the survey was specifically on the priority issues for the Abuja ministerial meeting. So the respondents were asked which ones were the priority for the ministerial meeting. And here you see a graph that might seem complicated, but I'll try to explain in simple terms. So the respondent were asking which one were the top three priorities. So those were scored as 1, 2, 3, and those are the blue bars. So obviously the more were mentioned, the higher is the score. So you see that sustainable financing for national action plans were indeed answered several times, both as a top priority, so a priority number 1, but also as a second or third. And that was also followed by the inclusion of civil society and communities in AMR governance, but also prevention when it comes specifically to WASH, IPC, and vaccination. And if you see the red dots here, also they represent specifically the ones that were mentioned as a top priority. So still the sustainable financing is top, but you see here, as I mentioned now, prevention and IPC were also quite high, as well as regulation of antibiotic use and strengthening of AMR governance mechanisms. Another question also quite interesting, I believe that the respondents were asked was indeed about the main obstacles for translating commitments into action. And as you can see here, the top response was indeed insufficient financing, so matching what was mentioned in the previous questions as well. But also the other results that you see are more or less on the same percentages. So limited awareness or behavioral change among health professionals and the public, weak political accountability, limited community engagement, as well as unclear governance, role across sectors, and fragmented system preventing data from informing action. I'm not going to mention all of them, but you can see also how the respondent indeed answered this question, and you will see also reflected obviously in the coming slides. Section 3 of the survey was about specifically governance and accountability of AMR. Those questions were both open-ended questions and some also multiple option questions. Here, what I'm reporting is one of the open questions. So the respondents were asked, what concrete financing or implementation commitment would you like to see from the governments in Abuja? So I tried to summarize here all the different responses, and you see here in the orange rectangle, so respondents called for predictable domestic financing, accountability, and implementation-focused commitment rather than new policy declarations. I also want to mention some of the responses more specifically that I wanted to highlight here. So some respondents said financing should not stay on paper, it must reach communities. Others responded, we need implementation, no more declarations. And others said that domestic funding is key to sustainability. So another question was more on the perspective when it comes to the commitment in national or in global AMR governance and the main challenges connected to that. And as you can see, the majority here answered that limited awareness and political prioritization of AMR was the main challenge in their specific context. And that was followed by the lack of financing here in brighter red. So the lack of financing is definitely a trend that we see throughout all the different questions. But also in high percentage, we see that fragmentation across sectors was also answered, which I would say perhaps not necessarily surprising. And then in a similar percentage, also weak national implementation, as well as limited inclusion of civil society and communities with 10%. Another open question that the participants were asked was about what is one practical change in the global AMR governance that would be most impactful to strengthen implementation and accountability. Also here, to summarize the response, they converged the respondent towards the need for a binding accountability system and not only voluntary coordination. And here also I want to lift some of the responses specifically in quotation marks. So the gap is not in strategy, but in enforceable accountability mechanisms. It's important to establish a mandatory transparent reporting and accountability framework for national action plans with standardized indicators, annual reporting, and independent review. And our respondent instead said, it's important to adopt the legally binding global agreement on AMR with clear targets, secure financing, and an independent monitoring and enforcement system. Section 4 was specifically about civil society and community engagement, also obviously in connection to the ministerial meeting. So the participants were asked to which extent were communities and civil society engaged when it comes to AMR initiatives in their specific context. As you can see, the majority said the community engagement was limited or occasional, followed by communities are generally not involved, which I think it's again gives more credit to the fact that the survey brought up those messages that I hope we can discuss also in the coming panels. How can we ensure to instead change this narrative? Also, another important question here related to community engagement in the specific context of the respondents, and specifically asking what type of engagement, but also were the factor limiting this meaningful engagement. So in general, the respondent summarizing, they said that when it comes to AMR, communities are largely limited to to awareness activities with minimal involvement in decision-making and constrained by structural barriers. Also here, highlighting some of the specific answers that community engagement in AMR remains largely symbolic, shifting to co-creation and accountability is critical for effective implementation. Others said that communities are usually treated as recipients of awareness messages rather than active partners in designing, implementation, and accountability. And a third participant mentioned that there is a need to move beyond awareness to co-creation approaches, where communities can actively participate in designing, implementing, and evaluating AMR intervention. Similar, in the same lines of what also Masika was mentioning in the beginning of the meeting. One other question, also I think quite important, highlighting which one of the population groups the respondent thought they were mostly overlooked when it comes to AMR policy in action. As you can see here, with 27%, the respondent selected the populations living in rural or geographical remote areas, but also marginalized or low-income communities are the ones which are mostly overlooked. Also in high percentages here, we see displaced refugees or conflict-affected population, as well as youth and adolescents. So I'm extremely glad that also our panel today actually lifts some of those perspectives more specifically. So as you can see, it's really hard to summarize what are the core messages because I believe that each one of the answers to the question are extremely relevant. And indeed, we're here to make sure to amplify all the different voices. Hence, the reason why we're going to share the results afterwards. But if we are to select perhaps three messages that can also be later discussed in the panels are the following. So respondent one, implementation and financing, not additional declaration. Accountability and transparency are seen as fundamental gaps in current AMR governance. And communities and civil societies must move from the margins to the center of AMR implementation and decision making. So yes, now I wanna thank you first of all for listening through the results, and there will be, as I mentioned before, time for asking questions. Actually, I can take this moment also, I believe I have enough time to say that you can write your question in the chat. So feel free throughout the webinar to write your questions in there. And now we will pass on to the next section of the webinar. And before doing that, I want to introduce my colleague and friend, Pablo Estrella Porter. Pablo is chair of the World Medical Association Junior Doctors Network and is also chair of the Quadripartite Working Group and Youth Engagement for AMR. And Pablo will help us through the next sections, which will have both a part of Mentimeter, so please listen to Pablo's instructions, and then moderate the first panel. So over to you, Pablo. Thank you.
Thank you so much, Andrea. And we're really happy also to make this section a bit more interactive. So we will ask you to scan the QR code, or you can also enter the link that was just shared in the chat. Here we want also to present a couple of questions just to hear your thoughts to drive the next panel. We see already a couple participants joining. Okay, we'll wait a few more seconds. We have already 10. Great. So probably we can start with the first question and feel free to keep on joining. So the first question we want to ask you is, what is the biggest barrier to AMR implementation in your context? You can put a word, a phrase. We're seeing financing is already appearing. Okay, so now we're seeing more diverse answers, but still financing is still on the core. We have lack of political will, awareness, the knowledge and financing. We have the lack of coordination, the polarization. Okay, we'll give a couple more seconds. But it's interesting. You see that also the more term is repeated, the more that it will show here. So we see that financing still on the center, but also the lack of awareness. The misuse of antibiotics, we have some of them. The lack of enforcement. Okay. Engagement of community voices. Great. So probably we can jump to the second question. And for this second question, we want you to tell us which groups do you think are still left behind when we talk about AMR response? So we have groups in conflict settings. So which groups do you think are still left behind? People in poverty. We have also elderly population, migrants, rural communities, local health workers, minors, marginalized communities. Okay, so we're seeing quite a diverse set of answers on the rural living, queer community, great. We see a few more. The community health workers, cancer patients, of course. But we still see at the core, or the most repeated ones, on queer communities, people in poverty, elderly, and rural communities. Perfect. Thank you so much, Salman. And I think with this first introductory part, we will jump to the first panel. So this first panel, I'm really glad to be moderating. It's thought as from the ground up, barriers and opportunities for AMR action. I would like to introduce our three panelists that will be together with me. First of all, we have Rabia Ajay Kali. She's a Tanzanian global health specialist with over 10 years of experience in TB, HIV, gender-responsive programming, and community system strengthening. She's the founder and national director of TB Women Tanzania and serves as the national TB facilitator with Tanzania's National Tuberculosis and Leprosy Program. Welcome, Rabia. Really happy to have you. Also, we have Charles Ogu. He is a public health and data professional working to advance antimicrobial resistance governance, youth leadership, and health system strengthening in Africa. He serves as the program and data officer at the Dusit Blue Foundation and is the chairman of the Nigerian Youth AMR Community of Practice. Welcome, Charles. And finally, we have also Fitriya Iskander, who is an Indonesian medical doctor, environmental activist, and public health researcher specializing in climate, environmental health, and AMR. She is pursuing an MPH in environmental health sciences at Rutgers University and serves as the focal point for the environmental health working group of the Children and Young Major Group to UNEP. Welcome, Fitriya. And with this great panel, I would like to start also asking one first question to my colleague, Rabia. So Rabia, I would like to ask you, from your experience, what would you say is the biggest barrier preventing antimicrobial resistant commitments from translating into action locally?
Well, thank you so much. Greetings, good morning, good afternoon, good evening, depending from where you are participating from. And thank you so much, moderator, for this nice question. And looking from my perspectives, the biggest barrier for preventing the antimicrobial resistance commitment from translating the action into action locally is the disconnect between the policy commitments and the community realities. We have seen the presentation from Andrea that we have the global declarations, we have the action plan, but also we have the technical framework. Yet, many of the communities most affected by the MWALA remain excluded from the implementation and decision making. Again, I often say that communities are not failing the antimicrobial commitment, but rather the systems are the one failing the communities. Given the fact that antimicrobial resistance is frequently discussed as a future threat, but for many communities, it is already the daily realities that they live with. And again, looking maybe at the important frameworks that we have at global and national levels, the implementation always fails, to reach the people who experience the greatest burden, that is the community. And for example, for us working with the TB, tuberculosis, but also looking at the MWALA, it's not a future threat, but in the TB context, we see it as a drug resistance TB. And looking at the WHO data, in 2030, it was estimated that 400,000 people were estimated to have the drug resistance TB, of which behind these numbers which were mentioned, there was a person, there is a family, but also a community that is carrying a burden of this disease that is harder and more even expensive to treat. And the drug resistance TB, it demonstrates now what happens when the health system fails to detect diseases early, ensure treatment adherence, but also engage communities effectively. And looking at the MWALA, it's not only a laboratory or a policy issue, but rather it is a community issue. And in the mining communities, we saw on the dashboard that you presented, the groups we talked about, the mining communities where we work, the challenge is even more visible because these miners, they face conditions such as silica, dust exposure, overcrowding, mobility, but also barriers to health care access. And the people often face delayed diagnosis, barriers to accessing quality healthcare, and limited awareness of the antimicrobial resistance risk. Yet these realities are rarely reflected in the national discussion and the decision-making process. And the treatment is failing just because it's not only a health issue, but because it has become a family issue, a livelihood issue, but also it's an economic issue. And this is the same challenge that we have seen it. It affects the HIV, the malaria, the maternal health, but also in many other health priorities. In this case now, the antimicrobial resistance, it extends far beyond the hospital and the clinics. And it affects the animals that we raise, the food that we eat, the water that we use, but also the environment that we depend on. And Dr. Masika said it during her opening sessions. And that's why now, when we talk of the One Health approach, it's not optional, it is essential, meaning that the health of the people, the animals, the plants, and the environment is interconnected. And I also see it that community engagement should not be a box to tick after decisions have been made, but rather it should be a partnership from the beginning. And this is where community health workers comes in as a critical. We saw it also from the dashboard, how these community health workers are really very important because these are the people who educate the families, they support the treatment support, to the families and to these people, but also they promote the prevention, identify the barriers early, and they are often the first respondent when it comes to community being trusted in them. And despite all of the greatest work that we see in these community health workers, they are not trained, they are not supported, with tools, with capacity building. And this now calls us to invest more in the community health workers by providing them with training, but also reporting tool, digital technologies now, supportive supervision, but also sustainable financing, just like what it popped, with large pop. And it's because now, through this CHW or the community health workers, it will, they'll resolve or they'll help out to resolve the MWALA issue through people, but also through the community itself. And these are the frontline if at all they have the tools, but also the support that is needed. And Masika also reminded us on nothing for us without us. This, from the HIV context, they have been using it as communities. And this is the similar principle. I think we need to use it for antimicrobial resistance, because communities, they should not be just seen as maybe the beneficiaries of AMWALA programs, but rather they need to be recognized as partners, co-creators, implementers, but also as an accountability actors. And I must conclude by saying that these communities are not the last mile of implementation, but rather they are the first mile of sustainable change. And if we want to work on the AMWALA commitment to become the realities, we must move resource, decision making, but also accountability closer to the community where resistance is emerging and where solutions already exist. Thank you so much.
Thank you so much, Rabia, for helping us highlighting this disconnection with reality, how also this is a system failing the communities and a cross-cutting health issue. You already outlined some of the great ways for addressing these barriers, but now we will change the focus to another group from the youth. For that, I would like to ask Charles, in your context, how are youth currently engaged in AMR processes and where are the gaps? Oh, you are muted. No, we can't hear you. Probably if we can try to change the mic setting. No, not yet. Well, we figured this out. Charles, if you don't mind, we will jump with Fitria in the meantime. So Fitria, while we sort Charles' mic, would you like now addressing how can also community voices be structural integrated into the AMR governance processes, please?
Yeah, thank you, Pablo. Greetings, everyone. I'm like it's really inspired to hear what Rabia just explained, and for also the survey that has been explained for the result as well. I think those surveys is really important to inform, and then I think to institutionalized into the ministerial meetings as well, because it definitely captures. I see most of the results captures the concerns, and then the critical elements that I think most of us agree that should be demands to the these policymakers to strengthen the MR commitments, and some kind of like highlighting the engagement for the civil society stakeholders, and definitely the change that we need to see is definitely shifting from the top-down approach into meaningful and inclusive participations, instead of like the survey said, treating us the stakeholders as the passive recipients, but we need to shift that in to make it active participations, how this bi-directional discussions, and then contributions. I think it's really important for us to change this shift, and then to ensure that there will be like formal representations. We know that we have the youth represented for the MR working group, and I believe it's also important to have other stakeholders to be part of this, and then how to give the power into these working groups, youth and other stakeholders, to not only listen and then consult it, but also to participate from the beginning, from the start to drafting, monitoring, and evaluation. I think it's really important to highlight how it's meaningful and inclusive, so we can avoid this tokenistic approach. And also, I want to highlight the importance for us as the MR civil society, that we have this engagement at the regional and then international levels. I think it's really important for us also to bridge the grassroots, the communities that we live together, into these high-level meetings, high-level communities, and because we want this lived experience to be able to be heard. We want this lived experience to to share their perspective and others. So it's really important for us, like we in the COMG UNEP. So last year we have the United Nations Environment Assembly, and then that was the first time we have finally the environmental dimensions on MR adopted on the 11th on the list of the UNEP 7 resolutions. So it is officially, you can try to find in the Google UNEP resolution 7/11, the environmental dimensions of MR. So during that session for COMG UNEP, we organized this Youth Environment Assembly, and we invited a lot of people. And there are some, lived experience youth who are coming, and then the health professionals raising the concerns about the MR issues. And we invited the government of the Kenya as the champion of the resolutions. And that's how I can see it's really important for the government also to listen directly to the grassroots. And lastly, I think it's important to bring the same spirit, bring the same commitment to the national and then local governments, because sometimes, like most of the time, I see there's a disconnection. At the national level or international, we have this strong commitment, but when it's we need to make it into the provincial or the regional or the local level, it's the commitment is that strong, and then there's this gap that I think is really important for the national government to also close this gap to ensure that the local communities who are working to support this AMR will be heard. And then and apart from that, this national commitment needs to be strong as well. So it's like the commitment for the ministerial, for the adopted resolutions, policies, they need to be legally binding at the national level to strengthen these efforts, because we don't need a jargon to hear like every year, okay, this is important, but how's the national implementation, how's the local implementation, is it really strongly enforced or not? So yeah, I think that's my few points. Thank you, Pablo. Over to you.
Thank you so much, Fitria. I think you have really nailed it, showcasing also with real examples how to avoid this tokenism and actually working directly with the stakeholders and being included from the beginning. And now we will move to our third panelist. Charles, can we check if now we can hear you?
Yeah, can you hear me now?
Yes, fantastic, yes.
Oh, great. Great. So I believe you asked me how are you currently engaging AMR processes and where are the critical gaps. So I believe in Nigeria, youth engagement in AMR is real and is usually frequent and engaging. But one thing is that it is fragmented. You see, young people are active across multiple platforms, and they engage in community outreach, most especially in schools, markets, hospitals, and religious institutions. And one notable platform is the establishment of AMR InterVarsity platform, which are creating clubs in tertiary institutions, bringing together youth from different One Health spectrum. And however, to identify these critical gaps, I believe, or we believe, it is structural. There has been no national platform to more like coordinate and document or even amplify these efforts. So youth-led activities have lacked, visibility, leading to, should I say, duplication of works and under recognitions, and most significantly, I would say, limited meaningful access to, national policy processes like the Nigerian National Action Plan. And I believe that engagement has largely remained at community and advocacy level. So with insufficient integration into technical working groups and data generations or formal governance structure will really help in closing these critical gaps that have been identified. Thank you.
Thank you so much, Charles. It's also really inspiring. I've been able also to see firsthand working with your team, and especially with the importance that now we were having working with you, and especially involving these different networks. So in this panel, we've been able to kind of see the different approaches from the barriers to the how youth are engaging in this process, and also how community voices are integrated into the AMR governance. So we will have the questions after the second panel. So I would like also to thank our panelists for highlighting this first part of the discussion. And of course, more is to come, and we'll take the questions right after. With this being said, I would like also to introduce my colleague Salman. Salman Khan, he is working as a youth engagement consultant for React Asia Pacific. He's a junior doctor and a master's student in global health based in India. His past achievements include being a winner in the Trinity Challenge Youth Grant Competition and co-lead the 4th Global AMR Youth Summit, coordinating national and local initiatives on AMR and other public health issues. So welcome, Salman, and now the floor is all yours.
Good evening from this side of the world, and thank you so much, Pablo, for the kind introduction and also for moderating the panel. It was indeed an interesting one. As all of you saw Andrea's presentation earlier this afternoon or evening, wherever you're based, our survey respondents, clearly highlighted and identified financing closely related to governance and accountability as a top priority, and today's panel speaks directly to that. So I'm pleased to move us into our next panel, from commitments to action, financing, governance, and accountability for AMR. This conversation is central. We all know that statements and targets matter, but without predictable financing, strong governance, and clear accountability, national action plans will just remain plans on paper. And before we begin the panel, I would like to share a brief resource from React. It's a policy brief called Unlocking AMR Financing, Optimizing International Resources for an Accelerated Response to Antibiotic Resistance. So it looks at the gap between AMR commitments and the funding needed to implement them. It also highlights some practical ways to improve access to international resources for countries working on their NAPs. I invite you to scan the QR code if you would like to explore further. But before moving ahead with the panel, I would also request you to join the Whoop Lab once again. Just give me a moment. Yes, here is the QR code, and I believe Pablo has also shared the link again. Thanks a lot. Let's give ourselves perhaps 10 to 20 seconds for all of you to join, or most of you to join. The answers will appear as a word cloud like before, so single words or even short phrases would work best. And your response would also, enrich the upcoming panel. I think we're good to go. We have a good number. Just give me a moment. Right. So the first question is, what should be the top priority for Abuja 2026? Okay, prevention. Okay. We see a variety of responses here, but the ones that stand out include community and civil society engagement. Not to forget the commitments. Inclusion stands out so far. I also see communities, inclusion, commitments in health taking the lead, and financing slowly popping up. I'm going to give us 10 more seconds. All right, let's move on to the next one. How can we ensure stronger accountability for AMR commitments at national and global levels? I'm particularly interested to know your thoughts about this. The first response did resonate with me: youth leadership, youth inclusion, national policies, financing of CSOs, political leadership, legal binding agreement. That's an interesting point. We see answers pouring in, collaborations as well. There's political and youth leadership that's taking the lead, along with an interesting um, uh, opinion on legal binding. Halting the AMR fragmentation, that's indeed quite relevant. Financing of CSOs. I think I'll give us 15 more seconds, considering this indeed is a tricky question. Multi-sectoral accountability, all sectors being involved. Advocacy. Another interesting point that just stood out is CSO inclusive governance. That is indeed important. Um, all right. Thank you so much for participating in this, short, I would say, warm up. And thank you for setting the scene with your responses. And now I will go ahead and introduce the panelists who bring experience across finance, policy, and implementation to help us unpack how we can move from commitments to concrete action. We are delighted to begin this panel with our first speaker, Catherine Urbaiz, a founder and executive director of the Health Diplomacy Alliance. She leads efforts to integrate health into foreign policy and global governance, and she brings nearly 2 decades of diplomatic experience, having represented her country at the United Nations in Geneva, the World Trade Organization, and the embassy to the Swiss Confederation. And she's also chaired the Geneva-based CELAC presidency and served as her country's focal point to the WHO Executive Board, with expertise spanning economics, international strategy, diplomacy, and negotiation. And not to forget fluency in 4 languages. Catherine embodies the kind of multidisciplinary and cross-sectoral leadership that the AMR response calls for. Thank you so much, Catherine, for joining us. And without any further ado, it's a pleasure to welcome our second panelist, Dr. Philip Matthew, a public health physician at the WHO headquarters, working on AMR learning, antimicrobial stewardship, and civil society engagement. He has had senior roles in ICARS, REACT Asia Pacific, and India CLEN, and is pursuing a PhD at Karolinska Institute on AMR, access to medications and health systems. For me, it's a particular pleasure to introduce him, having seen firsthand his commitment to meaningfully engaging youth and communities in the AMR response. And more so as an alumnus of the REACT network, having him back with us today is truly special. He's exactly the kind of thoughtful, driven, and inspiring voice we need at this hour to address AMR together. Last but not least, it gives me great pleasure to introduce you, our third panelist, Oluwatomi Akinola. She's the AMR program manager at the Dr. Ameo Stella Adedowa Health Trust. As a public health professional working at the intersection of AMR, health policy, science communication and health system strengthening. She brings valuable cross-context experience from the Nigerian Center for Disease Control and Prevention and Public Health in England. Her experience is grounded in microbiology, infectious diseases control, and policy-relevant public health practice. What strikes me most about her is the rare ability to work across so many levels, from laboratory science to community engagement to national policy, and always keeping practical, real world impact at the center. So she's exactly the kind of grounded, solutions driven, and passionate voice this field calls for. Thank you so much for joining us today, all of you. And I will quickly begin the panel with the first question to Catherine. And in case you end up seeing someone peeping in the screen, it's my brother. He was trying to talk to me about something. Anyway, I'll get back to the panel. And the first question to you, Catherine, is that we can't deny that the momentum that once drove AMR to the top of the global agenda seems to be quietly fading. And with each passing summit, the window to turn commitments into action is growing narrower, despite the stakes being very high and becoming higher with each passing year. You have spent years working within diplomatic and multilateral spaces, and you understand what it takes to make these agreements stick. So my question to you is, what concrete commitments should governments make in Abuja to support this implementation?
First of all, thank you very much. It's a pleasure to be here in the panel and share with my fellow panelists about the discussion that is extremely timely. I will frame it different. What I will say that the question should be is what we have there as commitments in order to implement. If we look at it, we already have a good base of works at the governance level. So we have the quadripartite that is doing a quite amazing job in terms of the independent panel of AMR. We have now recently a global action plan that has been adopted a few weeks ago during the World Health Assembly. So that's a good base of the work that he's been doing. All the quadripartite organizations are been doing those works, and countries, they have national action plans. So there, in terms of governance, there is a lot. But if you ask me in terms of diplomatic, we have as a base, and that's what we look from in the Health Diplomacy Alliance, from a base perspective, you can take as a base the 2024 United Nations General Assembly high-level meeting on AMR. The political declaration gives us really concrete commitments. And if we look and follow those commitments that are divided in approximately 7 aspects, if we look at those commitments, we already have a lot of work to do there. We don't need more commitments. I will say undiplomatically, we don't need more commitments. We are looking at already 178, and I might ask to my colleagues to correct me if I'm wrong, countries who have in those national action plans, and this has been mentioned in the previous panel. We have around 20 countries of that who have secured budget lines for implementation of those national action plans. So there is a gap between the financial commitments and also what are the governance aspects. So we have, obviously, there are 4 areas that we can say that are quite, in terms of governance and diplomatic aspect. The political cycles in governments is really short, and that happens at the national level and that happens at the regional level. So that really witnessed the commitments that we already have there. There is a fragmented governance, I will say mostly at the national level, between coordination of the multi-stakeholders. So that being said, is not what commitment to Abuja, and I mean, I would like to bring it into that. If the meeting of Abuja is a meeting that it will not take place, it's been postponed, has been informed already by the multi-stakeholder partnership that is going to be postponed, unfortunately. But what that brings us is that we have to reflect. It gives us an opportunity to reflect. Why? Because the ministerial meeting should be a checkpoint towards the commitments that we have already agreed in 2024. We should not create other agreements other than the one we already have, because we have a lot. So there is an implementation gap and a political, I would say, a political and diplomatic failure. So that means that we still have to work a lot in terms of how we implement that and how we close those systematic gaps. What we have to ask, and this is something that we are doing at the Health Diplomacy Alliance, and then I will stop there so I can give time. So I don't know how much time, but I love to talk about it. But I don't want to steal time from my other fellows panelists. What we look at it from the Health Diplomacy Alliance is what has been committed, who is responsible for committing, who is responsible for finance, what is being financed, who is monitoring, who's having the responsibility of accountability, and what are these commitments that we already have, we don't need more, are there in terms to get political attention or political feasibility in terms of implementation at the national level. I can go more into the details of what Abuja must deliver or should have delivered in terms of the engagement in terms of financing, Ministry of Foreign Affairs, monitoring mechanism. But I will stop there and provide the opportunity to my other fellows panelists in order to start the discussion. Thank you so much.
Thank you so much, Catherine, for highlighting the fact that we have concrete goals, in front of us. It's all about how we implement them and how we coordinate them. So it's not just a matter of what new commitments should we make, but it's a matter of what commitments should we, how should we work upon our current commitments. And thank you so much for highlighting that. I'll move on to you, Philip. We hear a lot about the need for more AMR financing, but less about what good financing actually looks like. And from your work across health systems and policy, I'd like to bring that conversation to life. So, according to you, what does meaningful financing in national action plans look like in practice?
Thank you, Salman, and I'm very glad that you didn't ask me where the money is going to come from. Rather, the question was more about framing meaningful financing, which is a slightly easier answer, I would say. I think we can all agree on one thing: the AMR, the National Action Plan agenda, has stalled somewhere, right? It hasn't really taken off in a way that we wanted it to take off, unfortunately, for various reasons. And lack of financing is right there in the middle of it. So, how do we define meaningful financing in this context? When you realize that the agenda is stalling, when we realize that the political capital is also a problem in many parts of the world. So we probably need to look at the reasons, for financing not to be there, and also look at framing meaningful financing in a way that people do understand. And I think this has been discussed a lot all across the world. AMR financing is very piecemeal. It is heavily dependent on short-term donor support, which in turn creates a lot of donor dependence, which in turn forces donor priorities on recipient countries. So it's a kind of a vicious cycle, which actually makes it very difficult to sustain core systems like antimicrobial stewardship or surveillance or health workforce training or infection prevention. So it's actually a vicious cycle which actually keeps us from expanding this domain or strengthening the areas which are critical to the global AMR response. So what does meaningful financing mean? I think in practice, what Andrea presented is exactly what I wanted to say. It should be predictable. It should be long term. It should be domestic. More and more money should be coming from domestic resources, including budgetary finance, I would say. So meaningful financing will mean embedding AMR into national budgets for sure. It shouldn't be treated as an external project. It should also mean that we are able to align and mainstream AMR into broader systemic efforts, right from efforts related to universal health coverage, to water sanitation and hygiene, to primary healthcare, and even to One Health. So all of that put together, that defines meaningful financing. But at the same time, we have to look at financing going beyond the national level, right? It has to permeate or percolate down to the subnational and the community level, which is not happening right now. Whatever little financing is there, it is actually limited to national level activities, and the frontline doesn't really get anything. That's where the implementation of the action happens. That's not, getting any kind of money. So if you look at it, in practice, what we are asking for should be financing for stewardship teams, for IPC teams in hospitals, for implementing laboratory strengthening initiatives. So those kind of frontline activities should be a priority. We should also have dedicated funding lines for community engagement. That theme came up a lot during today's conversation. So how do we ring fence money available for community engagement and civil society engagement and awareness raising and the mobilization that we saw in certain other domains, including climate change and even in TB and HIV. And again, there should be a method to actually track how money is spent and how money is actually used and dispersed in a very decentralized way. So if money doesn't reach where the work is happening, this won't lead to any particular impact. I think the next broader point I wanted to highlight was the need to reflect the multidisciplinary and multi-sectoral nature of AMR. I think the One Health dimension and also the development dimension, the equity dimension of AMR, this should also be reflected in financing. So there should be some kind of a coordinated financing across these different sectors. And also this is an opportunity for us to dip into other pots of money, right? Including development financing, money for health security, and even money for food security. So I think expanding that definition is very, very important. I think we should also look at the accountability and results part of it. I think in the AMR, results-based management is often cited in all the national action plans. But if you look at the implementation reports available or whatever little is there in the public domain, we don't essentially look at that accountability part with great interest. So how do we connect financing with results, measurable targets and results, show to the government that we are providing value. The AMR community is actually providing value. Investing in AMR is actually a good value proposition for governments and governance. So that part of it has to be very, very clear for governments to put in money. And lastly, I think the last point is we should also include community engagement and equity-focused interventions, including supporting civil society organizations. I think the WHO Civil Society Task Force at AMR, Catherine is co-chair, actually. So we have consistently tried to portray investing in civil society as a high-value investment to government. So the idea is some of this financing needs to go into the civil societies, community interfaces, and community mobilization, which never happens, unfortunately. So, and also how do we include all these high-risk populations or underserved populations that Andrea highlighted in the beginning? And so how do we make this financing, whatever limited pot is available, how do we make it as inclusive as possible and as broad as possible? So in summary, I think meaningful financing is not just about asking for more money. It's all about the right kind of financing on the table. And I go back to that survey result. It should be predictable, it should be multi-sectoral, it should be decentralized, it should be accountable, and it should be inclusive. Back to you, Salman.
Thank you so much for elaborating not only the vicious cycle, and also how we could perhaps escape this vicious cycle, and highlighting how AMR is truly a problem that affects all other health issues as well, which countries at times prioritize without realizing that AMR tends to affect these issues as well to a great extent, which gives me a perfect opportunity to ask you the next question, Oluwatoni. So when crisis hit, the impact ripples across every levels. Laboratories lose funding, community programs come to a halt, and AMR drops off the national policy agenda at times. And you seem to have worked, across all these three levels, and you have firsthand seen what happens when such pressures mount. So, from your perspective, how can governments protect and prioritize AMR funding during overlapping crises such as pandemics, climate shocks, or even economic downturns that we are also facing at this time and age?
Okay. Thank you so much, Salman. Just to say thank you so much. DRASA Health Trust is really pleased to be here and just contribute to this discussion. So rightly said, honestly, there are overlapping crises. And I think just listening to the news for a few seconds lets us know how much of a vulnerable world we live in with so many complexities. And I think I'll just share 4 points that are very important to consider. And the first is just keeping AMR politically visible. So before we talk about like safeguarding the funding, there has to be consistent and compelling articulation of AMR itself. So without that visibility, it can't attain the priority that it needs, the political will that it needs. And when that political priority is lacking, the funding then becomes vulnerable to reallocation, like you said. So it's like we just try to manage it across the different crises that we're dealing with. So we have to continue to communicate AMR not only as a health issue, as has been said by other panelists. Of course, it's a one health issue, so animal, human, environmental health issue, but also consider it as an economic development issue, a security issue, as well as food systems, and the fact that it's also affecting our national productivity. So it's important to make sure that governments understand AMR so that it can move up the political agenda and stay there. And the second thing I'll mention is about integrating AMR into health security and pandemic preparedness investments. So my co-panelists have already actually mentioned this quite a bit. And we have to realize that governments have to realize that recognizing AMR funding shouldn't just be viewed as maybe competing with pandemic preparedness, climate resilience, or health security investments. Pardon me. Okay. So like these are mutually reinforcing investments in surveillance systems, laboratory capacity, infection prevention and control, antimicrobial stewardship, workforce development, One Health coordination as well. Like investments in those strengthen a country's ability to prevent, detect, and respond to a wide range of health threats. And the third I will say is diversifying financing. So first of all, it's essential for us to have ring-fenced domestic financing. Like we can't escape that. We need to have that domestic allocation, domestic funding allocation. But then there's also diversification of financing. So we can make sure that there are other avenues of innovative financing we consider: public-private partnerships, corporate social responsibility initiatives, development financing, and revenue-generating models where appropriate too. And this, we have to make sure it doesn't just replace domestic funding, right? It just complements it. So where there are situations of crisis, we're able to have just an encompassing like funding landscape. And the last thing I'll mention is engaging parliamentarians and strengthening accountability. So it's often overlooked. And I think the legislative arm of government is often overlooked in the conversation of AMR, but they play such a key role in approving budgets, shaping policy, and just maintaining accountability. So like educating parliamentarians on AMR, regular engagement with them, it makes sure that we can have sustained investment through legislators. And this is something that the Global Parliament Against AMR has continued to work on. We're starting to just engage parliamentarians in Nigeria as well. And I know Zambia has done a lot of great work in that too. So governments need to strengthen accountability mechanisms, monitor implementation of the NAPs, and just demonstrate a return on investment of AMR interventions. And I'm mindful of time, but just to conclude, so governments can make sure that we protect and prioritize AMR funding by recognizing that AMR isn't a competing priority. It's foundational to our investments in health security, economic resilience, sustainable development as well. Thank you. Over to you, Samuel.
Thank you so much, Oluwatoni. I think you hit the right spot. It's about making the noise, the right kind of noise, and connecting the dots and making our decision makers realize that AMR is not a one-time or investment, which is just another issue to talk about, but it's something that again complements everyone that has said in this panel, it is a cross-cutting issue. So thank you so much for giving your inputs on that, and highlighting the fact that we should educate parliamentarians as well. So thank you, the three of you. This has been a genuinely rich conversation, and your combined perspectives across diplomacy, health systems, community practice have not just given us like an analysis, but a real sense of what action should look like and can look like. And a special thank you to everyone in the room for your engagement and thoughtful contributions to the poll. I think it's clear that this audience does not just attend these conversations, it shapes them. So thanks so much once again. I'll pass on the floor back to Pablo.
Thank you so much, Salman. And of course, as we want also to hear from our audience, we've been collecting also a couple of the questions. So I will invite all our six panelists. Also, I will just put them on the screen. We have this first question from Samia Islamusha. She's asking, how can we how can we ensure that community voices, especially those of young people and marginalized groups, directly influence decisions and commitments, in this case made at Abuja, rather than being heard only as recommendations? So we can hear probably from any of our youth members, but also any of the youth allies as well, even though I see, Fitaya, that you open your mic.
Yeah, thank you, Pablo. I think I've mentioned this in my intervention just now. It's really important to institutionalize the stakeholders' participations to not only being as the passive recipients, but they also need to be an active actors that can also shape the AMR strategy in this high-level meetings. So by giving the power to also participate in the discussions on the same table, I think that's the first step, because again, if we are on the outer, on the outer discussions, we're not just we just able to just give recommendations, so it will not be like meaningful. So and then for those who are able to speak on the table, who are able to be involved, I think it's also important to become the bridge for the grassroots communities. So whatever that we delivered on the table, it will be reflected properly, like for the grassroots itself. So I'm just giving one of the example for my participations in the decision-making process in the Southeast Asia level. We recently had adopted the ASEAN Declaration on the Right to a Safe, Clean, Healthy, and Sustainable Environment. And I was the only youth representative in there representing my organizations, and then how we try to bridge the local communities' voices. We conducted these consultations, reaching out to indigenous youth, to youth in their marginalized situations, to ensure that we capture their insights, their feedbacks, and everything, and then table it on the discussions together with the member states and other civil society organizations. And I think that's how the true, meaningful, and inclusive participation should look like, to ensure that we can reflect, the best voice from the grassroots to the table. Thank you.
Thank you. Thank you, Fitria. And if I can briefly mention also from the youth working group, something that we've been trying is also to centralize and also offer, there's different either opportunities, but also whenever we see that there's an opportunity for youth voices to kind of come together and also, unify the messaging, we find that also that can be our role. So we highly encourage those participating either in this case that I represent is more on the youth, but it works in any other groups, is to try to find those allies that are already working and make that message stronger. With that being said, we can probably jump to the second question from Maureen. Maureen is asking, how do we sustain talks on AMR awareness and stewardship efforts in LMICs settings when communities and health systems are also dealing with insecurity, outbreaks, economic pressures, and other urgent priorities? Yes, Philip, please.
Sure. Thanks, Pablo. I think it shouldn't be a one or the other question. It's all about how do we mainstream and include AMR in health security or development narratives. all of these various different things, So everything has an opportunity cost. So the ideal way to actually approach it is to actually see AMR as a meta issue, complicating the response to health security issues, to outbreaks, to everything that we are dealing with. Because there are various dimensions of AMR which actually complicates these other complex issues that LMICs are dealing with. So I think it should never be framed as a one or the other question. Rather than we should actually be advocating for a response which incorporates AMR into all these other different packets and domains. That's the short response to that question.
Thank you so much, Philip. I would like also to open the floor for any of the other panelists if they would like to add.
Hello.
Yes, Rabia, please go ahead.
Yeah, so thank you so much. And to just echo what Phillips has said, I think for me, the MWALA should not be viewed as a competing priority. And this is because it's a cross-cutting issue that affects these other diseases like the HIV, the TB, the outbreak preparedness, food security, the health systems, resilience. And the panel spoke about the sustainable approach of integration for antimicrobial resistance awareness and the stewardship into the existing community and the health programs. So this is really very important. We need to strengthen the communities, including the community health workers, and this will ensure now the communities understand now how the antimicrobial resistance affects them into their daily life. And generally, we know that this is not a separate challenge, but the MWALA is a broader health and a developmental challenge that the low and middle income countries are already working to address it. Thank you.
Thank you so much, Rabia. And we probably have just one more space for any other quick reflections from our panelists, either from this question or the previous one. Okay, I see. Not or Catherine, I'm not sure if I saw your hand. No.
Yes, you saw my
Yes.
hand. I'm trying to find the hand, but no, thank you very much. It's just a little bit to reflect on what the previous panelists have said. I think we should take this opportunity. We are in a really complex geopolitical landscape, and we should take this as an opportunity not only to wait for ministerial meetings to happen, but also to bring those commitments that we already have in terms of implementation. And I think it has been mentioned, civil society plays an extremely crucial role in bringing that accountability and accompanying governments, both at the regional, national, and the global level into the work towards tackling those commitments that we have. And also youth is there and has been really vocal into not only on the communities, but also not only being in the tables of those process of negotiations that are happening at the global level, but also being mindful in giving their expertise and introducing a lot of commitments and work into process of negotiation. So I think we take this is a really good webinar to take in consideration what we have ahead of us and be optimistic in terms of what we can do towards tackling AMR in a really more coordinated manner. Thank you.
Fantastic. Thank you so much, Catherine. I think was also this a great closure of the questions. But for closing also the event, I would like to invite now Andrea also for some final reflections. And probably also to ask all our speakers to turn on their camera. So while Andrea also give these final words, I can also take a quick picture.
Yeah, just let me know, Pablo, when you're taking the picture. Otherwise, I'll be talking.
Okay, so I'll be fast. Everyone look at the camera. 1, 2, 3. Fantastic.
Great. Thanks for the photo, Paulo, but also thanks for the excellent work that both you and Pab and Salman have been doing during today's webinar. I also want to thank all the speakers, first of all, like for accepting our invitation and for really supporting this platform that we're trying to provide. As I mentioned initially, it started back in 2024, the From People to Leaders, but the work that React has been doing with communities goes back to 20 years back. So it's really like continuous work that we're trying to do to bring together voices from community and civil society organizations. I also think, as many of you mentioned during today's panel, but also what we saw as results of the survey are indeed that community and civil society don't really want more commitments. I think Kadari was mentioning that, but really making sure that the commitments that are already in place are actually implemented. And then there is financing for those commitments, there is monitoring, and there is a way to hold decision makers accountable. And I think we are all responsible for that. And I also want to add that the discussion today has reminded us that this is not just a technical issue we're discussing now, but really is about equity, is about access when it comes to antibiotics and diagnostics. It's about prevention, water, hygiene, and sanitation was also mentioned quite a lot, and IPC, food system, the environment as a whole, health system, and trust. I think those are all important aspects that we should reflect on. And it's also, as mentioned, about both global and national policies at the same time and how those are able to respond to the reality faced by communities. I think was Rabia mentioning at the beginning, also making this connection between what are the communities' needs. Needs to go together with what are the financing also coming in. But it's important that the reality is that community are facing healthcare workers, young people, patients, farmers, and I can go on, many others, really working at the front lines of AMR are taken into account. And again, here we are doing a small part of it, but I'm hoping that this helps amplifying also other voices and other initiatives. As was mentioned before, the Abuja meeting has been now postponed. While this at the same time changes the immediate timeline, it does not change the urgency of the agenda. I think it's important to remind ourselves that it's still important. We have more time now for really strengthening our collective advocacy and making sure to sharpen even more our messages and really ensuring that community and civil society priorities are clearly reflected when the governments meet. So we have some homework to do, all of us. In terms of next step from React perspective, we're definitely going to share the recording of the meeting. We're going to share the results in their full palette of results as you've seen today. But although we want to continue working with partners to really make sure to consolidate those messages from the survey and especially also from today's discussion. I want to thank again all the speakers, really the moderators, the partners, and the participants, and really look forward to continue this conversation under the From People to Leaders umbrella, but also in the other platform mentioned before, the MSPP and the WHO Task Force, and many others that we are part of. So thanks once again, and see you next time. Thank you.
Thank you.